views and opinions expressed in this program are those of the participants and do not necessarily reflect the views of BronxNet or the program underwriters.
Hi, and welcome to Open BXRX Tuesday on BronxNet, a weekly program providing you the latest information, resources, services, and community efforts taking place locally here in the Bronx and virtually. I'm your host, Kevin Aline. Coming up, New York City public schools have reopened their doors to students and staff. We'll get an in-depth understanding of in-person learning during a pandemic. Has safety been pushed to the forefront over academics? Then a discussion with a licensed financial professional on generational wealth in the borough with some of the poorest congressional districts in the U.S. Could race play a factor? After that, October marks the start of Breast Cancer Awareness Month. Could lifestyle factors increase your risk of breast cancer? And New York City continues to make vaccinations more available to different communities throughout the city. But is there one community that still remains vulnerable? So please stick around. Open BXRX Tuesday starts now. Welcome to Open BXRX Tuesday on BronxNet. I'm your host, Kevin Aline, and I'd like to invite you to get social with us at BronxNet TV on Instagram and Twitter, and BronxNet Community Television on Facebook. New York City schools reopened just a little under a month ago, and with the addition of new protocols, the city promises families and school staff a safe school year. Here to talk about the first days back to school is Luis Torres, principal for New York City Public Schools. Mr. Torres, thank you so much for joining us.
Thank you for having me.
So let's get right into it. New York City schools have the largest public school district in the country and were reopened with no remote learning option. What were your thoughts upon learning this?
Well, at some point we would have to get back into the school building. I honestly thought there would be a remote option, but whatever the Department of Education feels is the right thing for us to do, I have no choice. I have to do whatever is best for my families and my children. So I'm going to make whatever situation is presented to me the best that it can be. So right now, we're moving full steam ahead with in-person instruction.
Now, did you have any fears upon starting the new year?
I mean, I'm human, right? So the reality is that with anything that is new, there's going to be some fear. More than fear, I was just basically trying to spend all my time strategizing and figuring out how to best serve my community. And whenever you're doing something for the first time, I mean, we've never had this type of experience before. You never know what to expect. You have children coming back that have experienced a lot of trauma, as well as the families and the staff as well. The staff experience trauma as well. So having that kind of gave me a little bit, I wouldn't say fear, but it made me become more strategic and in thinking about how to best serve my community.
Now, I understand throughout the summer, the mayor ensured families and school staff this would be a much safer school year than before. Can you explain some of the new changes made to keep the environment safe upon the entry for this semester?
So there's been a lot of changes. They made sure that every room has air filters in them. They sent out safety protocols. The PPE is being shipped to the schools and making sure the schools have the PPE. We're doing health checks that continues, as well as weekly testing that's going on in the schools. And, with anything, there's no 100% guarantee that there won't be an issue. But at some point, again, we have to move forward and we have to figure this out together. But at this point, we have it as safe as we can possibly make it.
So what have the first few weeks of school been like for you?
The first few weeks of school for me, it's like I've been a principal 16 years. It's like my first year. Testing things out. I'm observing things. I learned from my past experiences through the COVID experience, and basically it feels like I'm a brand new principal, and I'm looking for different ways to improve things and learning from those things that work. So, for example, our parent meetings are through Zoom, and we increased parent engagement that way. We had a lot of parents attending meetings through Zoom. We're looking at other things that we can do to improve where we were before the pandemic and things that we learned during the pandemic.
So there's been so many changes to, increase and ensure safety. Do you feel there's been an increase in tension on safety over academics?
Well, the reality is, before you can focus on academics, you have to make sure that you create a safe, nurturing environment. You can't even focus on academics unless safety is addressed and is a priority. Then you can start to focus on academics. We've been doing a lot of work around SEL, the social emotional component, and making sure that our children's minds are right, and making sure our staff's minds are right. It's what needs to be done at this time. We're coming back from a trauma situation, and something that we've never experienced before. We have to address those things first. We have to address the trauma first, and then we can focus on the academics. I always tell people, for a lot of our families, education is a fifth priority, actually a sixth priority, because technology now is comes before education, right? So you have food, shelter, safety, health, and access to technology. Then you have education. You have to address those five things first, and then you can educate our children. Where we talk about health, we're talking about mental health as well. We have to address those issues in our society, and then we can focus on education.
So the city is determined to keep schools open. Can you walk us through the protocol for when there is a positive case in a classroom?
Well, it hasn't changed much. You have a positive case in the classroom. The child is sent to the isolation room. Parent is contacted, and then we have what is called the situation room. Will determine whether the class needs to be shut down or if the school needs to be shut down, depending on the severity of the cases and the exposures. So the processes that were in place during COVID continue. That hasn't changed much. And it's really the schools working together with the situation room to make sure that we are doing what's best for the school and the best interest of the school. But let's hope that we don't have any positive cases in my school. But the reality is there are systems in place if there is a positive case, and we want to limit as much as possible the spread or the exposure to others.
That's a really great point. So that kind of leads into this. New York City made plans to increase testing. All New York City public schools will conduct randomized weekly testing rather than biweekly testing. Do you feel this will be enough to combat the spread of COVID?
Well, if we had all the answers, we wouldn't be where we are right now, right? We have to put in place what we feel will limit as much of the spread and the issue. So even before the city introduced the COVID testing, the weekly testing that we're doing now, our school has a Montefiore clinic in it, and Montefiore provides rapid testing here in our school. It's not the case in every school, but most community schools have that option. So I strongly feel that having testing available and getting the results right away can help us to limit the spread and ensure that all of our children and families are safe.
Now, with a focus on the students, what's it like running a school with young people who have a responsibility to keep themselves safe and wear masks daily?
So at the elementary level, it's a little bit challenging the younger you go down in the grades, right? So the 3K pre-K it's a challenge every day to have 3-year-olds and 4-year-olds wearing a mask. As you move up the grades, it's a little bit easier because the children understand the severity and understand why wearing masks are important. I'm fortunate that our school, we've been training our children early on, so we pretty much don't have a lot of issues with children not wearing masks. But again, when you have a 3-year-old, it's a whole different world with a 3-year-old. You have to build up their ability to understand and wear the mask.
Now, I'd really like to know, have discussions about vaccine mandates made it more challenging to lead your school?
I don't think the conversations are the issue. I think more than anything are the actions that are going to be taken. At some point, people who are not vaccinated won't be able to work in our school system, and that will lead to, of course, schools having vacancies and people who will not be returning. So that's going to be the challenge, is providing coverage wherever there are gaps. Strategically, I've created partnerships with colleges and other things. So I'm always looking to have like a backup to the backup plan, So it's going to be a challenge. And I understand why the Department of Education is doing it, but it's going to be a challenge to fill gaps, throughout the year.
Now, have you seen any academic challenges from students who are transitioning to in-person from remote?
Right now, a lot of our focus has been on the social emotional, and we're currently doing the assessments. In the coming months, we'll have a better idea as we continue to do assessments and we start to take away the baggage that the children are coming in with as to what we need to be doing academically and where the children are academically. But I can tell you that based on just human nature and the world, that whenever you have a situation like this, that everyone's going to have some kind of loss. It would be almost impossible for you not to have a loss. It was broken education for a little bit. It's also the mental health aspect of it and the stresses that cause our children to block certain things. With all of that said, we know that all of our children are going to need some extra support.
Lastly, can you just, there's so many things changing with COVID and schooling. What are your hopes for the future of New York City public schools in regards to safety and education?
My hope for the schools is that we will grow and learn from the mistakes of the past and also learn and grow from the things that worked. We should not throw the baby out with the bathwater, like people always say. There was a lot of great things that came out of the pandemic as far as education, ending the digital divide and ensuring that all of our children have adequate resources. That needs to continue, and actually we need to push it even more so that we ensure that all children have access to all the resources that they need to be successful in life and in school. So, if there's anything, we just got to keep pushing forward and not go back to normal. Normal was not good for everyone.
All right. Well, thank you so much for joining us.
Thank you. I appreciate this.
We'll be right back.
We know that people are dealing with the health crisis, but there's also a lot of food insecurity.
We're giving out healthy food options, and that's what's key here.
If you're a senior, you have a disability, they'll actually deliver meals to you.
The residents are anxious, they're worried, they're scared, they want to be tested.
When things were happening in our community and we couldn't get the help.
There's almost a presumption
of criminality that attaches to your skin color.
The site will prioritize those who are at highest risk in the population.
If you feel symptoms and you'd like to visit one of these COVID-19 testing sites here in the Bronx, you may call the State Health Department's hotline.
Important to note about this site is no reservations are needed. This is a walk-in clinic.
A lot of us are out of work and looking for something to do.
We have the machinery and the skills to make large scales of these masks and gowns.
Take care of your people. It's going to go way further than we actually can understand.
Right now, employees like myself are just adjusting to the new reality.
Reporting from BronxNet, this is Franchesca.
Welcome back. Today, licensed financial professional Lisa Camposano joins us for a discussion on generational wealth and what that looks like in the Bronx. Lisa, thank you so much for joining us.
It's my pleasure.
So can you just start off by telling us a little bit about your background working as a financial educator?
Absolutely. So I've been a financial educator for a little over 3 years now. I'm actually born and raised in the South Bronx. So one of the things that motivated me to get started in this industry, it was to not only just have the resources to be able to help myself and my loved ones, but at the same time, help others in my community as well.
So as many of us probably know, the Bronx has some of the poorest congressional districts in the country. In what ways do you think the pandemic has heightened that problem?
So as we know, the pandemic brought a wave of unemployment to our nation, especially to, our country per se. We had over 46 million people that applied for unemployment. But if we actually look at, the U.S. Bureau of Labor Statistics, we see that the Black workers had an unemployment rate of 13% compared to their white counterparts who were at 7%, right? So this just goes to show us in itself that our communities didn't have jobs, which means that, bills were left behind, and the money that they did have saved up were just going for basic necessities. So this widened the wealth gap in our nation entirely.
And you kind of hinted at it a little bit already, but many have found that this is not just a regional concern, but race plays a huge part in these disparities. Can you explain why we see this, particularly in Black and Brown communities?
Yes, statistically speaking, the RAND Corporation has a research study that talks about how the Black community, the Black and Brown communities, take an average of 10 years to get back on track on the income that they had prior of recession. So if we're talking about the last recession that we had that was between 2007 to 2009, and then in 2019 we had another recession. So right when people were getting back on track, they were hit with the pandemic, right? So it kind of set them back. So it takes them much longer to get back to the wealth or on track to creating that wealth than it does for their counterparts. So this is why we see a lot of these disparities in our communities because of just the income levels and everything else that it plays a factor into that.
So you mentioned, that before, financial literacy is very important to you. And as somebody who identifies as Latina, why was it crucial for you to understand the world of finance?
It's actually a great question. For me, personal finance allows me to see the world. Understand money allows me to see the world in a different perspective. I see it full of possibilities, and those possibilities allow me to bring more opportunities and help my community, which in then allows other people that look like me, right? Other people of color to see that they can also do the same. So to me, it's not just about me, it's about us as a community.
So the pandemic highlighted the economic disparities that we have in our community. Do you think it also made people more aware of the issues many of us were already facing?
Absolutely. It definitely made people more aware because now it hit home, right? We're talking about over 46 million people that apply for unemployment, and a lot of people were not working. And whether you were working or you knew of somebody who wasn't, right? And especially because of our communities, underserved communities were impacted the most. I believe that it made people more aware of these things, and it says, well, now I really have to get prepared, right? We don't plan to fail, we just fail to plan. And this allows people to open up the gates to what can be and how can I prevent this from happening again.
So in recent times, we see it all over social media and just like online discussions. More communities of color are discussing generational wealth. Can you just explain, or for anyone who doesn't know, what generational wealth is?
Yes. So I believe that people are ready for change. And generational wealth, in essence, is being able to accumulate wealth during your generation, and build wealth, and being able to pass that on to the next generation. And really, you want to do it within multiple generations, not just one, right? Like the Rockefellers, they've been able to pass on generational wealth for 18 generations now, which is extremely impressive. So what we want to do is be able to pick up the skill set, financial literacy, to be able to position ourselves to build wealth. And I believe that more people are ready to have these conversations.
So I know it won't be easy, but how can Black and Brown communities even begin to, try to achieve generational wealth?
Well, first things first is before you're able to help anybody else, you need to help yourself. So you need to get financially educated. Financial education is key to everything because that would allow you to understand what stocks investments are, investing in real estate, building a business that you can then pass on. Investing in your child's education is key. Investing in life insurance, right? Life insurance, a lot of people don't know this, but life insurance is the most affordable way to pass on generational wealth, especially within our communities. But it really starts with financial literacy.
So I kind of want to shift a little bit over to home ownership. When it comes to home ownership, District 13, which consists of neighborhoods like Kingsbridge in the Bronx and Washington Heights in Upper Manhattan, have the lowest percentage of home ownership at just 4.2%. Could this be a link to the lack of wealth in these communities?
Yes, so the 4.2 percentage that you're referring to, it's mainly pertaining to the home ownership in the Hispanic community. Interesting enough, overall in Congressional District 13, they're at a 10%, which is actually the second lowest compared to Congressional District number 15. So in reality, what we do see is that there is a huge proportion to the people that are investing in home ownership or getting ready for that. It has a lot to do with their income, right? So if we see that, there's a huge correlation to how much you earn and how are you willing to invest in a home. So you need to be prepared for that, but it all comes down to the educational piece and how can people feel ready for that investment, because it's set to be one of the biggest investments of your life. And what can you do to make sure that once you have it, you are in a position to be able to pass it on as well.
So that kind of leads a little bit into like my next question about like what does a higher percentage of home ownership indicate about a neighborhood? I also would just like to know, is it truly important when you're thinking about generational wealth?
Yes. Of course, we see home ownership as one of the many ways to build generational wealth, but for many people, is more about chasing the American dream. And when you chase the American dream, you're talking about a home and the white fence, right? But we do see that there's a huge correlation between how much you earn and the average income of these districts will determine a higher home ownership in those districts. So if we're able to provide people with the resources on how to become more financially aware of their situation and also how to increase their source of income so they have more money to then make these investments in the future.
So I would like to kind of go back to a little bit talking about, just people of color, specifically Black and Brown people, since we experience this the most. Do you think, there's a lack of educators of color in this field? And could there be any mistrust because of that?
Yeah, so I do believe that there's a huge lack when it comes to financial educators, specifically of color. I believe that because of this, it brings people, you can relate to someone that looks like you, right? So I've had this experience myself getting into the industry. The average financial advisor, financial professional it's a Caucasian male. And that also goes to show that we need more people that look like us having these conversations so people can just say, well, this conversation is only for the rich. This conversation is only for the wealthy, when in reality, it's a conversation for everybody. But people need to see more people like us having these conversations so they can open up and trust us in the process.
So I love that you mentioned that it's a conversation. I know that a lot of younger people, maybe millennials, are having this conversation. But how can we make this a multi-general conversation where we're adding in our parents and our grandparents?
This is so interesting because of course, where you are in life, in regards to, getting prepared for a home or having kids or retirement, college, etc. All these things play a picture in your perspective on finance, right? So in reality is having the proper resources that can relate to that individual in their stage of life. But I do believe that it just starts someone in the family. Like for my household, it started with me, right? I saw that there was a huge disparity and I know that I had to do something about it. And because of that, I opened up the conversation in my household because finance or money was that this taboo conversation, but it is changing that it's now okay to have these conversations. So we need to make it a norm in our household across everyone, really, and being able to make it more of a norm allows people to open up more often.
And that kind of leads me to my next question. I know that sometimes, you may walk past a building, you have no idea what it is, and they're having classes for financial literacy. And sometimes people maybe are afraid or they just don't take that step. What are some ways we can encourage low-income communities of color to actually get more involved when it comes to being financially literate?
Yes, so I'm a big believer in resources and especially things like financial education. To me, is it should be a priority and not an option. That's why what we do here with our campaign, we offer free financial webinars, whether it's in person or online. Majority of our classes are still online right now, so it makes it easier for people to plug in and be exposed to this information that it really impacts them in so many ways. So I believe that for some people, yes, they still hesitate because nobody wants to be put out there. But when you're able to make it so accessible for them and allowing them to have or read the resources and the downloads and things like that at their own time, it makes it takes them away from the spotlight and allows them to do it on their own time.
All right, perfect. Thank you so much for joining us.
You're welcome. Take care.
We'll be right back with more Open BXRX Tuesday. Welcome back. October marks the beginning of Breast Cancer Awareness Month. Joining us for an in-depth discussion on the disease is nurse practitioner from Montefiore Einstein Cancer Center, Micheline Dupont. Ms. Dupont, thank you for joining us.
Yes, thank you for having me.
So let's jump right into it. It's Breast Cancer Awareness Month, and according to the American Cancer Society, breast cancer is one of the most common cancers in American women. Can you first explain what happens to your body when you have breast cancer?
So breast cancer starts off very small as kind of small cellular changes. So picture your cells as like Lego blocks that just follow a pattern and build normally, stacking one on top of another. When you have breast cancer, the blocks start to change and they start to change shape. And a lot of times our bodies can, get rid of those cells that grow in an abnormal pattern. But when it can't, it proceeds to become malignant, to become cancer. And it can be at different stages in the breast. Sometimes it can be in the lobules, it can be in the ducts. But when it leaves the lobules and the ducts of the breast, it becomes invasive cancer. So it's invasive in the sense that it's left the borders of your breast tissue and started to spread.
So are there any lifestyle factors or habits as well as inherited genes that can affect breast cancer risk?
Inherited genes definitely contribute to breast cancer. If you have a strong family history of breast or ovarian cancer, you should definitely mention that to your provider so that we can start screening you earlier. Typically, we consider first-degree relatives, mothers, sisters, aunts, grandmothers, as those to pay attention to if to consider yourself at increased risk of breast cancer. You can also just do lifestyle modifications just to be as healthy as possible. Reduce your weight, limit your sugar intake, limit excess alcohol. Just try to be as healthy as possible.
Now, according to the CDC, despite improvements in early detection and treatment for breast cancer, Black women continue to have the highest breast cancer mortality rate. Can you explain why we see these disparities in so many health issues amongst African Americans?
Yes, so there's tons of factors as to why African American women and just women of color in general tend to suffer from breast cancer and have a higher mortality rate. Tends to come from socioeconomic status. So I've seen patients in the office that perhaps are the sole provider for their family and can't afford to take a day off of work. So they'll just let a breast mass just grow and grow and grow. And considering most breast masses for breast cancer are not painful, they just don't seek treatment until the cancer is pretty advanced. So that's one aspect of it. Then we can't take away the impact that slavery has had on African American and people of color's health in general. We tend to have a distrust of healthcare. So where other nationalities may run to the doctor whenever they have an issue or concern, we tend to seek other therapies or seek other treatments, or would prefer to turn to religion, as I've seen, and God is not going to let this cancer advance and that kind of stuff. So it's definitely a challenge, but I think that that's starting to change a little bit more, where women of color are considering seeking treatment earlier and having a little bit more faith in science than they had prior.
Now, according to Montefiore findings, breast cancer has increased in the Bronx and New York City, and the incident rate is highest amongst those who are 70 to 74 years old. Can you just elaborate on this a little bit more?
Right. I believe that after 65 years old, a lot of women don't necessarily screen for breast cancer anymore. Maybe it's not recommended by their primary doctors. So that's why they just stop getting mammograms. And when they do have any breast imaging, it might be because they felt a lump. So that could be part of it as well. And then there's also just the process of getting older. Like I said, cancer cells are cells that grow abnormally. And when you're younger, your body can kind of catch and stop some of these malignant cells from taking over. But as you get older, that process seems to be less efficient.
You also found that the mortality rate is highest amongst non-Hispanic white women and Black women. Do you know why that is? And could economic background affect that?
Definitely. As I mentioned before, if you're still working and you can't get the time off to go to the doctor or to seek imaging, you don't have those connections readily available, or if it takes a long time when you're at the doctor before you're seen, all of those factors play a role in whether or not women seek treatment. And a lot of times, like I mentioned, cancer is not necessarily painful. So if you don't examine yourself and you don't go to the doctor regularly to get a breast exam, your disease is going to be found at a later stage.
So the American Cancer Society also reports since 2007, breast cancer death rates have been steady in women younger than 50. What age do you typically suggest women begin looking for the signs and symptoms?
As early as in your 30s and 40s, you should start looking for signs and symptoms. I recommend that when you take a shower, the best way to examine yourself is with your arm up. This way you pull all the tissue back and you can really feel anything that's lying underneath. So arms up and palpate and feel around with your fingers flat. So don't grab the tissue, because if you grab the tissue, everyone has a lump, right? You're gonna get nervous. But if you palpate it with your fingers flat and just feel around for any lumps, believe me, you don't have to grab the tissue to feel anything. If you have something, you'll feel it with your hands flat. And just do that on a regular basis. And get to know your breast, get to know what's normal for you, what's not normal for you. That's the best way to really be able to catch something early.
So I love that you kind of walked us through, what to look for, because I have heard that we can do that at home. But I've also read that most breast lumps are benign and actually not a cancer. So we don't want anyone being freaked out, like you mentioned. Can you just elaborate what that actually means?
So yes, a lot of the times, if you're feeling something in the shower when you're in your 20s and 30s, it tends to be benign breast lumps. They tend to be painful. So benign is like not cancerous. So we can have a cyst in our breast. Cysts are just fluid-filled sacs. And you can have cysts in your breast. You can have them in your liver, your kidneys, and ovaries. Those tend to be benign. Okay. You can also have solid tumors in your breast that are benign, like fibroadenomas, especially when you're young. Those feel more solid. Those can be more painful when you have your period and when you have your menses. So and they can change in size based on where you are on your cycle, and both of them, the cyst and the fibroadenomas. So it's very true that when you examine yourself, you may be feeling something benign, but on the odds that you're not, it's more important to be on the safe side, just to get it checked out, know what it is, get an ultrasound, get a mammogram, get it confirmed that it's not anything cancerous.
So I love that you mentioned that. And that kind of leads me into this next question where, discussions with doctors on health can be very intimidating for some people, especially when you include the possibility of cancer. It can be frightening for some. What advice do you have for those who are afraid to basically just take that first step?
The best advice is to consider your pros and cons, right? an uncomfortable conversation versus actually having a malignant disease is quite a difference, right? It's quite an extreme. So if you are uncomfortable talking to your provider, I suggest that you find one that you are comfortable speaking with, because it doesn't make sense for you to put your health in the hands of someone that you don't feel comfortable talking to. So if there's a provider that you are not comfortable with, find one that you are comfortable with, let them know all of your concerns. And most providers really want to help you, right? They don't want to dismiss you. They don't want to say that what you're telling them doesn't make sense. They will refer you to specialists. They will refer you to for imaging or for testing to make sure that you feel confident about your health moving forward.
And then can you just explain what options are available to those who suspect that they have breast cancer? And can you tell us about Montefiore's screening efforts for breast cancer?
So if you suspect breast cancer because you have a strong family history of breast cancer, or because you actually feel a lump and you don't know what it is, you should reach out to your primary provider and get referral for imaging and possibly to see a specialist. Montefiore is working on getting screening mammograms for people of color, people in our community in the Bronx. Since COVID happened, a lot of people stayed away from doctors. So we're reaching back out to the community to make sure that women are being screened. So we have a breast cancer and cervical cancer screening event on Saturday, October 9th, 9 a.m. to 1 p.m. You don't have to have insurance. Because I know not having insurance is a deterrent. So you don't have to have insurance, but you do need to make an appointment. So Saturday, October 9th, between 9 and 1, we have the information and the phone number to register for the event listed below. The last time we did the event, it was back in 2019. We screened about close to 70 women. We did over 50 mammograms. And we actually did some biopsies on site. If you don't have insurance and you have a lump, this is the perfect event for you to register, because if we do suspect that it is cancerous or it's something that should be checked out, we can biopsy it on the spot.
Ms. DuPont, thank you so much for joining us.
Thank you. Thanks again for having me.
We'll be right back with more Open BXRX Tuesday.
We built a media network for you.
BronxNet TV.
Come learn in your new state-of-the-art studios at Lehman College.
At Mercy College.
And coming soon to the South Bronx in the Hub.
Inspire with your stories, culture, history.
Your Bronx on BronxNet.
Engage with us.
Connect with us at your channels and at BronxNet.tv.
Learn, engage, inspire. BronxNet TV.
From the Bronx
to the world.
BronxNet.
Welcome back. Vaccine efforts remain a huge part of New York City's recovery, with vaccine outreach expanding to different communities throughout the city. Here to talk to us about the vulnerable community of patients with intellectual and developmental disabilities is Dr. Karen Bonnick and Joanne F. Siegel, co-directors of the University Center of Excellence in Developmental Disabilities, Albert Einstein College of Medicine, and faculty in the Department of Pediatrics at Children's Hospital at Montefiore. Thank you both so much for joining us.
Thank you. Thank you.
So we're just going to jump right into it. According to your findings, patients with intellectual and developmental disabilities, also known as IDDs, are 3 times more likely to die from COVID than the general population. Can you just explain why this is such a vulnerable community?
Yes. Pre-existing health conditions such as Down syndrome, obesity, cardiac and respiratory illness are common factors and create complex medical issues for our population. So these conditions make them more vulnerable to getting the illness. They have close contact. Individuals have close contact with their caretakers, and many times individuals with IDD have difficulty with masking and social distancing. A lot of adults in New York State live in congregate care settings, which also basically is a reason for the illness to spread. And so they were very vulnerable, particularly during the beginning of the pandemic in New York State. And again, those living in group residences, many of them were older and had these complex medical conditions.
Now, Karen, can you explain what efforts Montefiore is making to address this health disparity?
Sure. Well, we can highlight one of them, which is our Vax DDNY grant, which was an effort really has multiple prongs. The first is partnering. We knew that in order to do this work, we had to reach out to the community. We couldn't do it alone. So as you said, we were able to draw on our existing network. We had provider organizations under the Interagency Council, Special Olympics, and in addition, we developed new partners that serve the Chinese, Spanish, Korean, and South Asian communities with disabilities. That's number one. Number two is education. We've conducted several town halls featuring physicians geared to both agency and staff across all of New York State. And perhaps the most successful of these town halls were actually given in small groups to, let's say, Korean language, Chinese speakers. And I actually think that through some of them, we've changed some of their minds about their thoughts about the vaccine. And finally, the production and dissemination of original content. This has included videos, social media outreach, etc. So partnering, education, and producing content.
Now, can you explain, how this actually began? Was it a long process getting access to resources to create this initiative?
Well, we have a large network of organizations that we partner with. And right from the beginning, when the pandemic hit, because the numbers were so high in terms of people being affected by COVID-19, our partners came together and saw this as a critical need. And we were lucky. We have our New York State Developmental Disabilities Planning Council, who responded to our request for funding to initiate this project, which focuses not only in the New York City region, but we also have outreach with our partners throughout the state of New York as well. So this was the first time that we were able to really come together very quickly to look at a problem and try to come up with some solutions on how to help people during this pandemic.
Now, I noticed there was an effort to state that this is purely science-based information on COVID-19. Why was that important for your team?
Well, my primary hat is really a researcher by training. And so for me, I think that you must lead with science, you must lead with evidence and facts. There is no shortage, as we all know, of misinformation out there, but we felt we needed to get credible sources to people who may not access them in a format that they can use.
The Einstein Montefiore team, as you mentioned, is making tailored messages and content for this community. What can viewers expect when they come across this content?
Well, the first thing that we decided to do was to create webinars in multiple languages to reach decision makers in families. And we noticed that in different communities, the decision makers may not be necessarily the parent. They may be the grandparent. They may be a neighbor, like who influences a family in terms of their decisions. So we decided to go with providing these webinars in multiple languages to focus on diverse communities. And so we also created videos with advocates, and they could be family members who would talk about why they got the vaccine. They could be individuals with IDD who also got the vaccine. And so we wanted them to talk directly to families as to why they got the vaccine. We also developed a social media channels, including Twitter and Facebook, in order to disseminate information. And that's how we're reaching many of our individuals in our community.
Now, why do you think there's so much skepticism around the vaccine? And what would you say to combat vaccine hesitancy?
Well, first off, as I mentioned earlier, misinformation. A lot of people get information from their peers and not necessarily credible sources. Our goal is to share fact-based information in user-friendly languages in settings that people feel comfortable in. So as I noted earlier, in a town hall, let's say done in the Korean language, we have literally seen people change their minds in the course of an hour and a half programming. You've given them factual information in a small setting from a physician in their own language. So that is our role. You know, we also, unfortunately, we can't get away from the fact that both politics and fear play a part. And, you know, unfortunately, viruses don't know any, just like they don't know regions or race or political affiliation. You know, we really need to just keep with the facts, and that's what drives us.
Now, I like to focus on children for a minute. Do children with IDDs experience unique challenges, especially those who may not be of age to get the vaccine at this moment?
Yes, we hear from a lot of families their concerns for their sons and daughters who are probably have complex needs, healthcare needs, but who also now would not necessarily be eligible because of their age to the vaccine. So what we try to do is to work with our families and answer any questions that they may have. And we will be doing a whole series on children coming up in November to address the concerns that families may have, the mental health concerns, as well as just typical vaccine questions that they may have. Also, because what families are facing is a decision: do they send their children to school or not, knowing that they may be exposed to individuals who have not been vaccinated. And so children may have problems with wearing masks, and that may that have intellectual and developmental disabilities, and that puts them at greater risk for contracting the COVID-19. So we are asking the adults in their community, teachers, family members, bus drivers, to keep our children safe and make sure that everyone follows protocols for mask wearing and vaccination. And so we're very hopeful that children will be helped if they follow these regulations and rules.
Now, I understand that you mentioned, wearing a mask can sometimes be a challenge for these children. What can we as adults or just, people around these children also do to help protect them?
Yeah, I think that, as Joanne said, adults and anyone who is eligible to get the vaccine should do so. walk, don't run, but go and get the vaccine. Keep social distancing and keep wearing masks, because some of these children or even adults who have significant sensory issues just cannot tolerate a mask. So as was said earlier, we all have to sort of pitch in to keep the people in our community safe, and those who are most at risk. That is our responsibility to keep them safe. So vaccines, masks, and distances as recommended.
And how can people utilize the resources Montefiore has available at this moment?
So we encourage people to follow us on Twitter at VaxFaxDDNY. And you can also visit our UCED, UCEDD landing page at Einstein. And again, if you type in VaxFaxDDNY on our website, our information will come up.
Perfect. Once again, I'd like to thank you both for joining us.
Thank you.
That's all for our show today. Thank you so much for tuning in. I'm Kibben Aline, wishing you and yours safety and wellness now and always. See you next time.